So I bought a UV machine from Jonathan a while back and just started using it because everything I buy I have to use. And what UV blood irradiation is, it's an immunotherapy that uses UV light to either stimulate or downregulate the immune system, and it says as necessary, and I really think it kind of does whatever it needs to do when you run the blood through UV light and put it back in the dog. It just seems to make them better for a variety of reasons. For who knows why it makes them better, but it does. But the use of light as medicine, to me, this is like the most basic thing ever. Started in 1845 when a doctor named Bonnet used sunlight to successfully treat tuberculosis arthritis. Then 10 years later, a doctor in Switzerland opened up a thermal station, and they coined the term heliotherapy, or sunlight therapy, to treat people for various diseases. And then the Nobel Prize in Physiology or Medicine was given to this doctor, Niels Finsen, in 1904 for treating lupus vulgaris, because he had a 98% success rate using UV treatment for skin conditions. And that was just at that time UV topically, like just putting the light on the skin. In 1928, doctors used the first UV blood machine on a human patient who was moribund, who was septic, who was delirious after a septic abortion, and that patient survived. So this man, Emmett Knott, had been watching from 1928 up to 1946 what had been happening, and he was a physicist and decided to make an actual radiation chamber. His chamber exposed blood for about 10 seconds at the high peak wavelength of 257.7, which is a UVC. His chamber was good, different, because it allowed the blood to not coat the sides of the tubes that it was going through, so that he had maximum exposure. I couldn't find any research on what these guys were using. I don't know what their UV chamber looked like. So there's Emmett Knott and his machine. His first experiment used dogs that he injected with Staphylococcus aureus, and he used 3.5 mils per kg of blood exposed to UV light and then put back in the dog. All treatment dogs survived whenever he used this dosage. The higher, they were first taking all the blood out of the dog. That didn't work out, but the 3.5 mils per kg worked out for him. We don't use nearly that amount of blood at all, and it's still fine. Here's some excerpts from an article written 1938 to 1941. When I was in graduate school, nobody ever read those old papers, right? We were allowed to read like 1990 and above. Like nobody, and all that I'm like finding this out, I'm like, they did some cool stuff. So that's very important. And as you can see, this is number of cases and numbers that recovered. If they treated these different, most of these are itises, in bacterial infections. Everybody lived. Whenever it got to more severe, they didn't live as frequently. Some of them died because they started too late. And then they summarized all these cases. Their early treatments all survived. Middle of the road guys who were, sick a little longer, not as many, 98%. And then whenever they were severely, it's just dying. 47% recovery. So that's still pretty good, right? 47% if they're on their deathbeds, they're still living. It's good. So if you read any paper on UVI, this is the one to read. Came out in 2016, so it's pretty new, but it's got a lot of references, and you could go find those papers that it references, but it's a great review paper. It talks about what we know about how it works. And then just the other day, I found this Substack page. Well, I've been reading this guy for a while, but he's got a lot of good things. But the other day, he had UV blood irradiation revolutionized medicine. This is a very long article, and he's got all these references. You can click on it. It takes you right to the scientific paper. So he's a really good writer, and that would be a good place to go if you're interested in finding out more about it. So you only need a few pieces of equipment. You need your ozone generator, which everybody should have one of those anyway. And you need your UV light machine, which Jonathan has. That's his, and you can see it at his booth, and that UV light has UVA, B, and C bulbs in it, and I would say the only thing I have to make sure I change them regularly and watch them, but we use it all the time. So this is Jonathan's slide on how to do it. This is not a difficult process at all. So, whoops, sorry. I'm going to show you that in a minute. Take the blood out of the dog, and the amount of blood that you take is dog dependent. I would say 10-pound dog is 2 to 3 cc's. That's about my smallest. I don't do much smaller than 10. 100-pound dog, you're looking at 30 cc's, maybe at the very most. I have a whole chart, so I don't even memorize it. The chart. You put the blood in an IV bag that Jonathan sells you, and you add saline to that, and then you add ozone gas to that bag, and we usually rock it a few minutes, get everything all mixed together, hook it up to an IV pump. So it comes out of the bag, through the IV pump, through the light, and then it pumps it back in, and there's a little tube that comes up here, and it drops out of the tube on the top. And on your IV pump, you're putting in the volume and all of that, so it's all, whatever it's done, it tells you it's done. And then you take it out of your IV bag and put it back in syringes, and then I use a butterfly catheter to put it right back in the dog. It takes about 45 minutes for a total. So this is my dog, this is our demonstration. So take the blood, you use a butterfly, put it in the bag, add your ozone, rock it a little bit, hang it up. That's the tricky part right there. Kylie does that really well. I usually make a mess, getting it all into the thing. There's a cuvette system, which I'm sure Jonathan could show you, that allows that blood to kind of roll through that light so that the whole thing gets exposed. That's a nice little system so that you get maximum exposure. Then after it's done, you put it back in syringes. And then you put it back in the dog. That part takes putting it back in the dog, I don't know, 5 minutes. We just do it slowly so that the vein doesn't blow. And then you're done. That's that. So what in the world is going on when we run this blood through light? There's a lot of information out there about what it's doing, but when I look at that information and then I look at my patient, I still don't know why it works. That's why. But it activates phagocytosis by white blood cells, removing dangerous material, obviously, viruses, bacteria from the blood. It's interesting to me, the cell surface area of red blood cells is decreased after UV blood radiation. So if you radiate blood who you're going to transfuse like into a different patient, you get a better survival of those red blood cells. Not that we do transfusions every day, I don't think I've maybe done two, but I found that interesting, so it's making those red blood cells more viable. Increased nitric oxide, increased reactive oxygen species, and decreases a cytokine storm. There were a lot of human beings that used UV blood therapy during COVID. It's an awesome thing. UVB, the one light in there, either inhibits or kills lymphocytes, possibly reducing systemic inflammation. Maybe that's why it works in lymphoma, and it does work in lymphoma. I've had quite a few cases of lymphoma. We have done UV blood therapy on those dogs, so they've survived. And we use that as the only treatment. Like, I don't even think I use Pred on any of them, just UV. So in our office, what do we treat? We treat a lot of autoimmune disease. I don't know about you all, but autoimmune disease walks in the door every day. Allergic skin disease, which is autoimmune, walks in the door every day, and we do a lot of blood therapy for these allergic dogs. I'm going to talk about protein-losing nephropathy today because in my hands, protein-losing nephropathy is a big deal when it happens and it's hard to fix. But using UV, these dogs can get a whole new lease on life. Different cancers, I mostly have used it on lymphoma. It seems to work nicely. The dreaded tick disease works very well. I'll talk about that. Skin infections, non-healing wounds, pneumonia, and any itis, any bacterial infection. it should be effective on. So I'll talk about treatment of Lyme disease first. This is my dog, Molly. Excuse me, she's a 13-year-old Great Dane. She's probably a mix because she's about 110 pounds. She came from the shelter. On June 6th, she woke up and she was not able to walk. She was lethargic. She was not Molly herself. I took her into the clinic. Her last tick test was negative in August 9th of 24, but that day she was Lyme positive. We sent out the C6 to IDEX, and it was 67. We didn't get that until after we treated her, but we knew that it needed to be treated anyway. All of our other blood work was perfect that day. And the last time I used doxycycline on Molly, she tried to die because she developed an idiopathic hepatopathy. That happens in 4% of dogs who you treat with doxy. And in my hands, if I don't tell them, it's guaranteed to happen. So we tell everybody that, and it did happen to Molly. That was pretty scary. So I was not going to do that to her. So we did UV blood therapy in the office that day. She hung out with me. And a few hours later, it was time to go home. She wasn't getting up. She's 110 pounds. She was not getting up. And we had to lift her into the car, put the euthanasia solution in the car, and I gave her a lecture and told her she needed to get herself together. So I got home, and as I'm pulling in the driveway, my husband's standing in the yard, and she goes, "Oh, there he is." Because I'm just the food lady. He is the best man in the whole world. And she jumped up, and she jumped out of the car and started walking around the yard. Okay. And then over the next few days, she was great and ran around. So I will repeat that C6 in 6 months, but honestly, most of my Lyme that we treat this way, I don't even do a C6 because the dog is lame, the dog has a fever. People are like, just treat the dog, don't even do that thing. So when I left to come to this conference, Molly was fine, going to the river, doing her regular stuff. This is Lucky. Lucky is about 8 years old. He is an intact male. He came here from Bolivia. His owner does not want to use anything Western medicine. Don't say the word antibiotic. Not happening. But he walked in the door with a fever, a right front lameness, and pretty soon was not walking, was not eating. He felt terrible. Owner did not want to do UV blood therapy that day. He wanted to do homeopathy. Fine, I can do that too. We did lead him, 1M every day for 3 days. He did fine with that. And a month later, he was not fine. He was the same deal. He was lame. He did not have a fever at that point, but he was not okay. So I talked to him about UV blood therapy again. He agreed to it, got UV blood therapy, walked out the door, didn't call me again. I thought, oh dear, he's dead. But he was not dead. 24 hours later, he was totally fine. I just saw him last week for another issue, and he hasn't looked back. So he did great. So those are my 2 examples that I brought of treating tick disease, but this is what we've done in the last year. Obviously, every tick disease that walks in does not get treated with UV because UV is $250, doxycycline is $25, but that's beside the point. There are still dogs that you cannot do doxy. I don't want my dog to have doxy, frankly, and I would do UV first, and I have several clients that feel the same way. As you can see, these different dogs had differing tick diseases, and they were all symptomatic, and they had either 1, 2, or 3 treatments, and that was all based on clinical presentation. This dog, for example, had 3. He had Ehrlichia Lyme. He lives in the woods. He is a silver lab. I don't think his immune system is the best in the whole world, but it took 3 treatments to get him back together. Yara is a chronic case. I think she's had Rocky Mountain a long time. I think I missed it. We didn't test her. Then we tested her. Oh, darn it. This is why this wonderful therapy dog is not right. She had 3 treatments and she's back to work, so she was good. So that's what we got for them. So protein-losing nephropathy, do you all see that a lot? So much, a little bit. I made this slide for a talk that I have to give to explain what protein-losing nephropathy is to dog owners, which someone try it out on you and tell me if it makes any sense. So protein-losing nephropathy, the problem is in the glomerulus, which is this picture, which I got off the internet. And this glomerulus is responsible for filtering our blood and to keep the proteins that we need inside our body and to get rid of the proteins that are really small or different charge or we don't need, and get rid of sodium, potassium, calcium, whatever needs to be worked out. And this is how I think of the glomerulus. The blood comes through the glomerulus, which is like a spaghetti strainer. And when these holes of the spaghetti strainer, which are fenestrations in the epithelium of the glomerulus, become damaged, proteins that normally would not go through those holes and out in the urine, and they don't stay in the body anymore, they come out in the urine because these fenestrations in the epithelium or these holes in your spaghetti strainer have gotten large, and the larger proteins now can fit through. So that's a bad thing, and then you're urinating out protein, so you're losing protein that you need. So protein losing nephropathy, as seen in our practice, is caused by autoimmune disease, tick disease. Those are the two main reasons it happens. Why? What are the clinical signs? When do we test for it? Usually these dogs come in and they are weak. They may have a positive tick disease test. Their appetite's not great, overall lethargic. Mostly dogs, not very many cats. I don't think I've ever treated a cat with PLN. I think I had one, but it wasn't having a big problem with it. And of course, we would do further testing if the urine has protein in it, regardless of what the dog was doing, right? Because sometimes they're not doing anything. And then they got the number 5 milligrams protein in their urine. So our diagnosis is doing the UPC, and we use IDEX. We have we have the clip for in-house, which I think that was the bomb to get because we do this a lot. Excuse me, general rule is that PLN is present if the ratio is greater than 0.5. They have a whole list of, if it's azotemic this, if it's not azotemic that. Oh, if it's greater than 0.5, it's a bad thing. Excuse me, and usually these dogs are much greater than 0.5, like 5 or 10, or they're losing protein like crazy. You'll also see on your blood chemistry a decreased albumin, but not always. Sometimes these dogs are able to maintain, even though they're losing protein like crazy, their albumin's okay. And many times globulins go up. So we kind of look for those in the blood work as well. Sometimes you do a chemistry and you're like, oh, look at that albumin, let's run this. So that's what we got. So common treatments in Western medicine, they like to decrease protein in the diet. I don't like to do that. And they like to give benazepril and telmisartan. I avoid these like the plague because I think they make your kidney go flat. And then I've not had anything come out of that. In our office, we use UV blood irradiation. I have one case where we use ozone water. I'll show you that case, which is awesome. But that's the number one go-to. I do not use blood protein diets. I don't think it's the right thing. And definitely fresh foods, no kill, none of that stuff. I do use Chinese herbal formulas, omega-3, and homeopathy. Before I had this, I only had this, and that it wasn't drama like we have drama now. And most dogs are just this. No, most dogs. Some dogs will do the whole 9 yards, but most of them it's just the UV. So this is Augustus. Augustus lives with 5 other huge dogs and his mom and dad, and they cook their food out on the porch in a giant pot, and they're amazing. I don't know how they do it. He is a 10-year-old Mastiff Labrador Retriever mix. He's about 116 pounds. He was vaccinated originally, but she doesn't do that anymore because he developed this in 2018, and it was a bit of a nightmare. We've gotten him through this. We got him through this before without UV. I don't think I had UV then. But this flares a little bit. He has autoimmune thyroiditis. His liver enzymes are elevated. We're always on the lookout for Cushing's with him because we kind of wonder if he's headed that way. His teeth are terrible. I don't know why. And he has DJD in his hocks at this point because he's just a big, heavy guy. So regularly we keep him going with Medrol. This is from the Pletchner protocol, which we did do a Pletchner test on him. That's why we went that way. Thyroid tabs for his thyroid, homemade diet. She modifies his diet amazingly depending on his skin inflammation. His remedy is sulfur. We have used an LM daily on him. We kind of use it as we need it. Haven't seen him since June. He's not on sulfur right now. And we have used some Chinese formulas as we need. Mostly all of this was skin, for skin, even though I think this is his constitutional. So September 30 came in. He just wasn't right. And so we did a chemistry, and I saw this. This is Augustus 2022, 2020. Look at his albumin is fine. Now granted, 2.7 isn't low, but something's happening. He shouldn't be at 2.7. So I did the UPC, and it was 4.25. So we said, okay, let's do the UVB. We did it on September 3rd. September 10th, we're down to 2.2. September 17th, we're back up a little bit. Did it again. 24th, we're at 2.5. We let it go. September 3rd, 2.75. She said, yeah, go ahead and do it. Back down to 1.5. And we have 3 more, 2.49. So, yes, this is not less than 0.5. But he's fine, and his albumin is here. Now, would I do more UV? Yeah, but it's $250. She's not coming back. The dog's eating, drinking, and happy. His albumin is holding, so we're holding for now. He is an autoimmune kind of dog, so I'm happy, very happy with this. Yeah, of course I want it to be 0.5. I don't think I've ever made anybody back to 0.5, but I don't care. I'd rather it be here than here, because if I let this go, where would it be now, right? It would maybe be at 2, yeah.
Are these 2-week intervals standard?
Everybody is different. Everybody's different. It depends on the client, it depends on the patient, it depends on the lab work, because who knows, maybe I would have done somebody else, it would be 4.25 and then down to 1.5 and stay there. Yeah, so it's just, everybody's different on how frequently we do it.
How closely?
So, Margot Roman does hers 24 hours apart. I haven't done that. I'm more a once a week kind of person. So I want to tell you about Chloe just because I can't believe this happened with his dog. Chloe Coffee, which I think Jonathan knows Chloe Coffee because she bought an Ozone machine from him. Yeah. So Chloe's 5.7 pounds. She's a little Spitfire, and getting 3 cc's of blood out of her every week to do UV wasn't going to happen, and her owner would have a meltdown. So Chloe came in with this history. I didn't see her till February 2025. So her history is from internal medicine, because she went internal medicine for a long time. Intermittent vomiting, diarrhea, weight loss, hyperexia. This is their diagnosis, GI, possible GI neoplasia, lymphangiectasia, which Yorkies love to get that. Primary enteropathy. They had her on budesonide. Then in October of 25 through February, she was again still treated for all these GI things. Chronic pancreatitis now. She's one big inflammatory dog. And then she developed proteinuria. Yay. So everything is inflamed in this dog. So they put her on Thomasartan at 2.5 2.5 milligrams every 24 hours, stayed on her budesonide. She was on budesonide forever. And then they had her on Fortiflora. This is her blood work before I met her from the referral clinic. Her protein creatinine ratio started going up, 4.3. You can see her specific gravity isn't great either. Her mu and creatinine is always elevated too, but I didn't put that in there. Budesonide, there's your Thomasartan. 4.2 was your protein. 3.4 started to come down. Then one day it was 19.7. So the Thomasartan was increased to 3.75, and we only got down to 14.81 on March 18th. And then the owner called us and said this. Well, I don't know what day she made the appointment, but she came in 21st. Urine output was much increased. She can't make it outside. She urinates every hour. They had discontinued this Thomasartan a week ago because she was passing out, and they found her passed out and peed. Her appetite decreased dramatically, and the owner was spending hours per day trying to get her to eat. She has sent me videos of her trying to get this dog to eat. The owner does not give up, and it's a good thing. So, not knowing what to do and figuring this was out of my league, I thought, well, I could do this, but I don't think it's gonna happen. So I'm just gonna try this ozone water thing and see if it happens. I gradually decreased the budesonide because I don't like, this isn't working anyway. She's still dramatically inflamed, and we did not restart that, so I'm sorry. So she has been taking ozone water daily since that time up till through today, and she is steadily improved. She cracks me up when she comes in because now she's all full of herself. The things that have improved, inappetence, she had constipation, the pancreas got better, the CPL dramatically changed. Like one time her CPL was over 900. Oh dear. And honestly, with the ozone water is all I did. That's all we did. Nothing else. No Serenian, no antibiotics, nothing. But this pancreatic inflammation finally is under control. And the owner said, all these little warty-like things she has all over her skin is now just little flakes of skin. It's really nothing there. So her UPC, it was 14.81 that day that they had that telmisartan really high. The day I saw her, it was 4, but, so I don't know why it dropped like that, but now it's about 2.15. Here's her chart, and this is also a little telling if you look at where we started. Day 1, I saw her that 4.8, constipation there. Started her ozone water, picks it up every 7 days, and she gets 3 cc per day by mouth. You can see on 424 when she received my her kidneys were not great. She wasn't feeling good. We just got her through it, kept doing what we were doing. Between 512 and 65, there's 24 days between ozone water pickups, right? And look what happened to her UPC. On 6/5, when she walked in the door, she had not picked up ozone water since 5/12, which things were doing good then, right? 1.58 was our protein creatinine ratio, everything was okay. And then suddenly it was 13.25, and I thought, what happened? So she got back on the ball game and picked up her ozone again, 2.10. I saw her the other day, she was a little bit higher than this. She has her own ozone machine now. I think it was leaking because she told me that she couldn't go in the same room with it, so I don't think her ozone water was good either. I was like, you need to call Jonathan because you're not supposed to smell ozone. But as long as we keep her on her water, it's good, right? So why do I not just use water? Because I think UVs is faster. It's faster. And I'm also at this moment of I can't stop the water, right? Because when she did kind of stop it, it went back up to 13 pretty quickly. So I would still rather do the UV than the water, but for these tiny little dogs. And this is her, see if that'll play.
What's the concentration on
The water, I just bubble the heck out of it. She moving. Sometimes when I'm sending it home, I bubble it twice, and then I send it home, because if I only bubble it once, I only get a couple days. So I just bubble it twice. It's 60, 20 for 11 minutes, so 60 micrograms, 20. Yeah, and then she sent me this text the other day. She knew that I was coming here. Oh my gosh, sometimes it's like she's 2 years old again. People that haven't seen her in a while are just awestruck at how good she looks and acts. They even have told us now, not back then, that they just felt that she was not going to live much longer. Even all her old lady warts that we have had surgically removed before, that just came back, are dissolving virtually into nothing from the water. She still has her bad days, but overall to see the difference in her brings our joy to our hearts. My husband and I are trying to be faithful drinkers. And they tell everyone that'll listen. So she cracks me up. A third use for UV blood therapy, I had a really good case come in. She's been seen for about a year now. It's for wound healing. You don't get a ton of wounds, but this one was necessary to use UV on. Panda is a 7-year-old female spayed Australian Shepherd that talks the entire time she's at the clinic. And we saw Panda after she had quite a long journey of treatments. Panda developed several conditions after a short treatment with apiquil and prednisone at a different clinic, not my clinic, together for allergies. She had terrible allergies, and they couldn't get it under control. The apiquil wasn't working enough. Somebody added prednisone, and then suddenly she had sepsis with pneumonia, fever, and a large liver. She was in a pickle. So they treated her just fine. She did very well at that clinic and this was all good, the pneumonia was gone, sepsis was gone, but during this period, these wounds developed over her elbows. I think she had a joint infection. Everywhere in the medical record, it says hygroma, but that was a joint infection, it was bad. At the first clinic, they did laser, they did Epsom salts wrapping, and they did all these antibiotics in 1 month, trying to get everything under control, but she's alive, so it's a good thing. And then they referred her to the board-certified surgeon in September who worked on her for 7 months. I don't know everything because they didn't tell me everything, but they basically did several procedures with the vitamin wound closure bandaging. They had the packs on her that drained the fluids, and she was on, again, several antibiotics, but her healing was incomplete, and the surgeon called us and said, do you have something else for Panda, because there's nothing else I can do. I don't want to do this surgery again on her. She's kind of a mess. So she came in, and we too didn't know what to do, but we changed her diet to homemade. She was previously on a variety of dry things and canned foods and different things they were trying because of her allergies, right? She just wasn't great. So we started UV blood irradiation weekly, and then we started tapering it pretty quickly. Topically used ozonated sunflower oil, Manuka honey, flushed with ozonated saline. Sometimes we use colloidal silver, but not at the same time. I just took her off of antibiotics, and then chemo support. And you'll see from these wounds, I don't think they were terribly, a little bit infected. I don't think she was septic at all at that point, so she didn't need antibiotics. So this is pictures of her left elbow and her right elbow on the first day that she came. This right one has been a bugger, but the left one, it was really down to the bone. You can stick your finger in there, it's the bone. So presentation March 21st, 2024. 3 treatments with UV blood therapy, less than 4 weeks. Left elbow is healed. It was totally closed up. It was totally fine. This right elbow, see there's some epithelium that's open right there, and it developed this lip thing, which has been an issue for her, but it did improve. And this was my 7 weeks. This is my 4 weeks left of. Oh, I guess this one was still open because we have 7 weeks. It was totally healed on the left, and then the right, you can see there's still some shiny spots here that's not 100%. And then this is over 12 weeks. There's still a tiny little bit. At this point, she still has this funny thing. We've talked about sending her back to the surgeon, but she's fine. It's not infected. There's a funny little thing there. This looks a little odd. She's $30,000 into this dog, and the dog is happy. Everybody's happy. So follow up. Panda visits us every 8 weeks now for UV blood therapy for the owner's request. Her wounds developed in August of 23, 7 months without resolution, began to heal in 4 weeks after UV was started. Left elbow within 11, I think that's about right, 24, I could be wrong exact numbers. Original allergy symptoms that were being treated with apophyl and prednisone are no longer present. She doesn't even lick her, she doesn't do anything. So again, in our office, what do we use all of this stuff for? Autoimmune is probably the number one. I've even used it for immune-mediated thrombocytopenia, which is a little frightening because when you have low platelets and you're putting ozone in it, but it works. I'm careful with it. I try to get the platelets up so that at least I know they're not 8, they're maybe 50 or 60, and then I do it, and then it goes away. And I did that because Margot told me that it worked, so I just did it. Cancer, PLN, skin disease, non-healing wound, antibacterial infection. Other uses of this fancy little machine. This is the best thing that I ever bought. I did it because I had a client tell me that I should get one. So I went and called John, and I don't know. These are other things that we use also, ozonated water or saline. I will say quickly. To make pancreatitis go away, you give rectal ozonated saline. I usually give it at like double the weight of the dog. 24 hours, the pancreatitis goes away. I might give them Serenia. Rarely an antibiotic. If their white count is really up, I'll give them an antibiotic. But this is the bomb right here for pancreatitis. I think I've had 2 patients I've lost to pancreatitis. They were both cats. I was talking in the last year because I just did this. I just said, I'm just gonna see what happens. And they were both cats, and I think they were just way far down the line. They were icteric, they were just a mess when they walked in the door. So I did not get those guys to live, but pretty much everybody else lives with ozonated saline per rectum for pancreatitis.